Good afternoon, everyone. Welcome to this regional North Eastern Yorkshire Healthcare Professions Graduate Employment webinar. And we're going to focus a bit with our guest speakers today on roles in private and independent healthcare providers as well. Quick session overview on the back of that as well. As I've mentioned there just previously, this webinar is going to be recorded and you are going to receive a copy afterwards. We are aware that some people have registered and are unable to attend today, so we're going to make sure you all get a link to watch that online at a convenient time, and we'll also make sure you get a copy of the presentations, and we'll also have some additional career support resources which I'll touch upon a bit later, that are going to be shared out with you via email when you're registered for this session as well. There will be time for question and answer session. You can submit your questions at any point in the chat box. I'll pop a message in there in a moment so you know which one that we're using. We might need some time to answer your questions after the session, so feedback will be provided if required. So we will, if you do ask some questions halfway through, if you think of anything, we will come to it at the end. If it's something very specific, if it's something really detailed that we maybe need to take away to speak to one of our workforce teams or a particular professional, then we'll do that and we'll provide further feedback as well. The email that you guys registered for this session, we're only utilising that to share any updates or feedback from this webinar. If you'd like to opt out, we've got our England Nursing North email address on the screen there. I would also just like to point out for any of you who are not nurses, midwives or allied health professionals on this call, you are welcome. We are going to talk about some of those roles. That is just our regional inbox. We will have AHP professionals, midwifery professionals that can access that. Don't be put off by the fact it says nursing. You find to email us. The final thing to mention there as well is that we understand at the moment it is very difficult out there. Getting your first role as a healthcare professional sorted at the moment is very challenging. We're here to support with lots of different advice and guidance to help you get your career path going, and to show different job opportunities across various sectors. Hence today we're discussing the private and independent sector. Just to heads up that some of our guest speakers may not work from the same profession as you guys, so they may be from a slightly different area, they may be from a slightly different registration, but we are going to endeavour to provide as much useful broad information about getting work as a healthcare professional today. But if there's a bit of a focus or there's a bit of a talk on a particular field of nursing or paramedics or physiotherapy or something like that, we're not missing the rest of you out. And if some of you do have, as I say, mentioned earlier, very detailed questions to your profession, please still ask them. It might just be the case of that we go away, we need to find out a bit more info, we need to link you up with some of our professional networks as well. So please, yeah, take note of that, but please ask any questions or queries that you do have as well. Quick overview of our agenda today. So just doing some quick welcomes and introductions at the moment. We then have guest speakers to talk about the importance of professional registration with either the HCPC or NMC, or it may be that some of you are dual or going to be dual registered. We do see that situation, so hopefully that's useful and you can share with any of your peers, any colleagues, this information as well, because it is really useful to talk about the importance of professional registration. So we've got Vesna from the HCPC today, and we've also got Mark Brook from the NMC, who may not be able to attend today, but I've got a recording of his session previously, which will cover exactly the same information, so I'll share that if needed. I'm going to quickly touch upon writing successful applications and preparing for interviews. One of our partner organisations at the National Career Service provide amazing advice and guidance support for any adults across the country, and they're running some additional webinars because we're not going to have time to cover things like interviews and applications today, and they're running some fantastic webinars. So I'll share information for that and how to access it and what dates and times that's on as well during the session. And then finally, finally, we're finishing off with Chloe Haig from Spectrum Community Healthcare, who's going to cover a lot of those different roles that they work with as an organisation. And we will make reference and we will share information for other organisations as well. Spectrum are a great community interest company who work across our region. So Chloe will be going over some of the offers and opportunities that they provide regionally as well. So what I'm going to do is I will just do a quick introduction, as I mentioned, to the professional regulation. I will, at this point, for the sake of the recording, introduce Mark Brooks, who is from the NMC and who's our Principal Regulation Advisor.
Let me just come off mute. Lovely. Thanks very much for the introduction, Paul. Yes, good morning, good afternoon, everybody. Time has flown already today. So my name's Mark Brooke. I'm a Principal Regulation Advisor and I work within the Employer Link Service at the Nursing and Midwifery Council. The role of my team is that we are an outreach team and we meet with and engage with chief nurses and or their deputies at all NHS employers within the whole of the UK, and also with some of the larger independent providers who provide a service in healthcare, again throughout the whole of the UK. We are, as a regulator, we regulate all nurses, midwives and nursing associates in England, again, as I said, throughout the whole of the UK. So I'm not a nurse, I'm not a midwife, I've never been a nurse, I've never been a midwife, and I'm not likely to be a nurse or midwife either. But my background is I was a police officer for 31.5 years in the Metropolitan Police in London, and I retired in 2012 as a detective sergeant, and I'd been working in surveillance at that time. I joined the NMC in 2013 as a paralegal. I thought I'd be able to bring my investigative skills across and also my knowledge of the judicial system to help with progressing some of the fitness to practice cases that come through the NMC. It wasn't long before Ambition took over and I then managed the paralegals in the team. And then in 2017, I became a regulation advisor, which allowed me the opportunity to come out and speak to both nurses, midwives and nursing associates, you know, from band 5 right up to band 8 and above. So I could talk to them about all things regulation. And so even though I'm not a nurse or midwife, I do know about regulation. Next slide, please, Paul. I always like to show this. Each year, Ipsos Mori go out and they ask members of the public, which professions do you have the most trust in? And each year the members of the public come back with a list of all those that they have complete and utter trust in. And I think it's always good to show for nurses that each year since nurses were introduced into this poll, which I think is about 8 years ago now, they have always come out at number 1. They've always become they've always been seen as the most trusted profession. And as you can see in 2023, that they were 88% of members of the public thought nursing was the most trusted profession. And then in 2024, that went up to 94%. Haven't got those for 2025 yet. But as you can see, that's a very high percentage of the public who have complete trust and confidence in the nursing profession. And to me, that's what's unusual about these this. It's not so much that nurses at the top, it's the percentage of the public that have that trust and confidence in yourselves. And you can see other professions that are also rated highly within that poll. Doctors always used to be at number 1 until nurses were introduced, say, I think about 8 years ago, and they took over the top spot since then. Doctors were second, then they've dropped down to third, where engineers have taken their place. And I can understand that. I think we have to have complete confidence in our infrastructure, the roads that we drive on, the bridges we cross, the houses we live in. So I think it's right that we have that confidence in engineers. Similarly, it's always good to see the other end of the spectrum, the other end of this poll. If you could just do next slide, please, Paul. And at the bottom there, probably doesn't surprise you, politicians generally, very, very low, 9%. Government ministers, not much better at 10%. could even go down again next year. But this isn't just particular to the UK. I think you'll find most countries, there's probably very little trust and confidence in their politicians and governments. And then also you've got landlords, journalists and advertising executives. I think we've all watched these adverts where they promise if you use this cream twice a day, you're going to look 10 years younger, when in reality it doesn't make any difference whatsoever. And similar with landlords, you'll see these lovely photographs of premises that you're going to view, whether it's a flat or similar, and then you walk through the front door and they look nothing like the photos that you viewed prior to turning up on that day. So probably understandably why those professions probably sit near the bottom, and the same with journalists. Next slide, please, Paul. Just on that though, when I talked about the high regard in which nurses are seen by the public, obviously with that comes a great deal of responsibility. Nurses, midwives and nursing associates are looked up to in their community. They're respected within their community, and therefore there's an expectation that they will behave very differently to perhaps other members of the public. Now, I'm not saying you can't go out and enjoy yourself with friends and colleagues and family, but you also have to be mindful that if people are aware that you're a nurse, midwife or nursing associate and you're on our professional register, they expect you to behave to a much higher standard than other members of the public. And if they see nurses, midwives or nursing associates behaving in a way that they think brings the profession into disrepute, then they do contact us at the NMC and make us aware of their concerns around that individual. I'm not saying we necessarily take all those concerns any further, other than the fact that they've been referred to us, but I think you just have to be aware how your actions, your behaviours, your words do affect not just whilst you're at work, but also in your private life. So the NMC's purpose, if you can just press next again, Paul, it should come up. Our purpose is to promote and uphold, no, go back one, sorry. Promote and uphold the highest professional standards in nursing and midwifery to protect the public and inspire confidence in the professions. That's the purpose of the NMC. That's why we're here. And that is primarily our role. Underneath that, you'll see the four parts of the code: prioritising people, practicing effectively, preserving safety and promoting professionalism and trust. Now, the code, I'd just like to say at this point, for those nurses on the call today, and if there's any midwives or nursing associates, that you may have heard that the code is there for the NMC to hold you to account so that when things go wrong, they can take your pin from you. That couldn't be further from the truth. Yes, if something goes wrong, if somebody makes a mistake or they do something that causes harm to a patient, there potentially could be a breach of the code, which might be referred to us as a regulator. But the main purpose of the code is there to guide and support you throughout your career. It's a document that you should be looking at, I would suggest, on a very regular basis, if not almost daily, just to make sure you're working within the professional standards that are expected of you as a nurse or midwife or nursing associate. Next slide, please, Paul. We're in the process of building a new NMC. The NMC has gone through quite a difficult transition over the last 2 years. We've had a culture review which has highlighted some real cultural issues within the NMC, where there were colleagues who felt that they were treated differently to other colleagues, didn't have the same opportunities, faced discrimination, whether it be racial or other, through protected characteristics. And so we really had to look at ourselves to make sure that everybody that works at the NMC has the same experience to their colleagues. And it was a real, there was an analogy used where you could have two people passing in a corridor and their experiences were going to be very, very different. And I think that was true of us as an organisation. But lots of work has been done to address the culture within our organisation. We've got a new chief exec, we've got a new executive board who have come in to really change the way that we work as a regulator, because obviously any impact on colleagues can potentially have an impact on those that we regulate. And normally you have a 5-year strategy, a plan, but because of those cultural issues, it was decided that the NMC would only have a 2-year plan initially, and then we would probably go back to a 3 or 5-year plan in the future. But so our 2-year plan, which we're halfway through, is about ensuring trust in professionals to make sure that the public have trust in you as nurses and midwives and nursing associates, and therefore have the confidence to come and seek your services when they need to. We want to improve our fitness to practice process, because you may have heard some stories about people that have been referred to the NMC, the time it takes and what's happened to them during that process. We're looking to improve that, the timeliness in that process. We've already made great strides, but we know there's much more work to do around that. I've talked about the cultural transformation, and I've also kind of touched on strengthening leadership as well. You know, we do have a new chief exec, we do have an executive board, and with that, the new chief exec has brought in coaching for all leaders within the NMC to make sure that we are stronger, more accountable, and we have this values-based leadership embedded within the organisation. We're looking to modernise the NMC, bring it up to date, digitalise it, and make it much more efficient than perhaps what it is currently. And then we've got this vision and the missions out there as well. I'm not going to go through all of those. What I will touch on though is our values, because our values, we only had 4 values previously, and we've now changed that to the ones that you can see there, which is all about integrity, fairness, respect, equity and effectiveness. They're the values that the NMC will now, and everybody working at the NMC will be expected to work to help support those nurses, midwives and nursing associates on our register. Next slide, please, Paul. So these are the NMC core functions. I've talked about our purpose, and this is how we ensure that we meet the purpose that's set out for us as a regulator. So we have a register. We have a register of every nurse, midwife and nursing associate who is legally allowed to practice in the United Kingdom. If you're not on our register, then you cannot practice in the UK as a nurse, midwife or nursing associate. And you cannot use the titles of nurse or midwife either if you're not on the NMC register. If you do, they are protected, and you could find yourselves actually being investigated by the police if you used to say that you're a nurse and you practice as a nurse without being on a register, and similarly with certain functions of that as a midwife as well. At the moment, there are just over 860,000 nurses, midwives and nursing associates who are legally allowed to practice in the UK. It's a huge number, and it's obviously quite a lot of work for us as a regulator to be able to maintain that register, because there's lots that we have to do to maintain the integrity that gives the public confidence in both us as a regulator, but also as you as nurses, midwives and nursing associates. I've talked about the code already, the professional code of standards and behaviours that you're expected to work throughout your career. And we also set the standards for education and training. So every education institute or approved education institute in the UK, which I think is 100 now. I think it's just gone up from 99, which had been at for some time. I think we now have 100 approved education institutes. We set the standards of education, but we don't tell them how to deliver their curriculum. But their curriculum has to meet those standards so that when you graduate, you then have the qualifications, met the qualifications and the standards to be able to then join the NMC register as a nurse, midwife or nursing associate. With education, we approve and assure all programmes of nursing and midwifery education. So any programme that's delivered throughout the UK, whether it's a pre or post registration, are approved by us as a regulator. You then have revalidation that you have to complete every 3 years. So each year you have to pay your fee to be retained on the register, and you're retained on the register for years 1 and 2, and then on year 3, when you pay your fee and you complete the revalidation process, you renew your registration. So you're retained yearly. Every 3 years you renew your registration. And then finally, fitness to practice, and that's where things have gone wrong. That's when either an employer, a member of the public, the police or other bodies, sometimes it can be a self-referral or a colleague, who will make a referral to the NMC because they have concerns about somebody's ability to practice safely whilst working as a nurse midwife or nursing associate. And then we have a duty to look at that allegation and decide whether or not we need to investigate it further. And if we do have to investigate further, whether or not that then needs to go through to a public hearing where there may be a sanction at the end of that. That's the one area that most people probably know us for, and that's probably the one area that most people are worried about when they think of us as a regulator. I'll just give you, later on, I shall give you some data around that will hopefully remove some of the worries about fitness to practice, and as I say, and hopefully dispel some of the myths around that you may have heard either prior to joining the register or just after joining the register. Next slide, please, Paul. These are things we don't do. So we don't represent nurses and midwives or nursing associates. There are other bodies that do that. You've got the Royal College of Nursing, the Royal College of Midwifery, and you also have unions such as Unite and Unison. They're there to represent and support you throughout your career should you need their services. And it might be because you've been referred to the NMC around a concern with your practice. That helps support you through that. It might be that you've been taken through a local disciplinary process, and again that helps support you through that. That isn't for us as a regulator, but there are bodies that help support you with that. We don't have a role in funding or training for continuing professional development, so we don't fund courses. We don't have a role in providing funding. There are other organisations that do that in all 4 countries. We don't have any powers to regulate employers. We only regulate individuals. So we're only the regulator for the 860,000, I think it's 801 nurses, midwives and nursing associates on our register. We don't regulate healthcare and care settings or commission training places. And when I talk about not having powers to regulate employers or care settings, there are other bodies that do that. In England, that's the Care and Quality Commission, and then you've also got other bodies in the other 4 countries that regulate employers, and they do have powers to come in and look at what is happening within that particular care setting, and they do have powers to place restrictions, on employers as well. But what we do is we work with all of those organisations in all the 4 countries to make sure that we're all consistent in the way that we regulate and that we're not doing things differently to others. So we make sure that we talk and work very closely with each other to ensure there's that consistency. Next slide, please, Paul. And if you press that again. That's lovely, thank you. I said I'd try and remove some of the myths around fitness to practice. As I've said, please see the code as a document or a booklet there to help and support you throughout your career, and not that it's something that the NMC used to take your PIN. As I've said, we've given out 860,801 PINs. We don't give them out with a view to wanting to take them back. So that's your PIN. That'll be your PIN for the whole of your career, and we have no intention of taking that PIN unless, of course, you were to do something really, really serious that meant that you might need to be removed from the NMC register. As I said, there's 860,000 on the register. You can see in 2024 to 2025, we received just over 6,500 referrals to the NMC. When you think 6,500 referrals only equates to 0.77% of the register, the chances of you being referred to us are extremely low already. So every year, only about 0.7 or between 0.7 and 0.8 of the register are referred to us at the NMC for us to look at the concerns that people may have around their practice. If you look in the box next to that on the right hand side, you'll see that out of those 6,500, we've closed 72%, so just over just under 4,000 in our screening process. And think of screening like triage, where you turn up to be assessed to find out what's wrong with you. We do the same in screening. we assess those referrals to see if it's something that we as a regulator need to take through our process. And if we don't, we can close it in screening. So out of those 6,500, we would have closed nearly 4,000. So again, when you take that number from the number on our register, you're now getting down to probably less than 0.5% of the register each year would actually go through for further investigation within our process. And then if you look right, I'll take you to the bottom right hand box, and if you look in there, the number of nurses, midwives and nursing associates that were struck off the register, that means they were removed from being able to practice, was 289. So when you think of 860,000 to 6,500 referrals, only 289 nurses or midwives were removed from practice in that year. So the chances of us taking your PIN from you at any point are now down to about 0.1%, if that. They are extremely small numbers when you think how many people there are on our register. And also on that, even if you're removed from the NMC register, if you're struck off, that is for a period of 5 years. After that 5-year period has expired, you then do have the option to go back before one of our fitness to practice panels and ask if you can be readmitted to the register. And you can provide them evidence of what you've done in the preceding 5 years to show actually now you feel you are safe to come back and practice as a nurse or midwife. Yes, there's other things you'll have to do to get back on the register, whether that's a test of competence or a return to practice course at university. But it doesn't necessarily mean to say it's the end of your career. There may have been something that happened 5 years previously that made you act or behave in a way that was completely out of character, and it's something that is unlikely, after these 5 years to happen again. And there are people that are readmitted to the register having been struck off. So please don't even think then that would necessarily be the end of your career. I'm now going to, next slide please, Paul. Talk to you about your PIN. Your PIN tells me a little bit about you. The first 2 digits, so if you just press it once, Paul, they should come up. The first 2 digits, that's the year that you joined the NMC register. So if you was to join the NMC register in 2026, those first 2 numbers will say 26. That's the year that you joined the register. You then have a letter. That letter is the month that you joined the register. So if you joined in January, that would be an A, B for February, C for March, so on and so forth. This isn't always exact, but it's pretty much a really good indication of when the month that you will have joined. You then have 4 numbers that just make it unique to yourselves. And then finally, the last letter is your country of training. So if it's an E, I know you've trained in England, S for Scotland, N for Northern Ireland, W for Wales, O for overseas and C for the EU. Since we left the EU, since Brexit, every nurse who comes to work in the UK from outside of the UK will now have an O at the end of their PIN. There's still some with a C because they joined when we was part of the European Union, but C's aren't given anymore because every nurse from outside of the UK, it will be given an O. So it just gives you an indication of where people have come from and where they've joined, where they've done their country of training. I always like to know just that little bit of trivia, just so you know there's that little bit about you and your PIN. Next slide, please, Paul, because now I'll talk about you coming onto the NMC register, your journey. Next slide. This shows your journey. You've been a student, you kind of jumped over that chasm and now you've landed as a newly qualified nurse, midwife or nursing associate. Next slide, please. So we'll touch now on your registration. Next slide. So what happens when you finish your course? Your university will upload your course and personal details to our database, and they send us a declaration of your health and good character. Or good health and character. And once we have everything from your university, we'll send you a letter to let you know how to create your NMC online account. What I'll say about your NMC online account at this point is when you create that, please, if you change your contact details, your email address or your permanent residential address, please let us know. because it's those contact details we will use should we ever need to get in contact with you. So we'll use your email address to contact you when it comes to when you need to pay your retention fee, also when you need to revalidate, and also for any other queries that we might need to make with you. So please do make sure you keep those contact details up to date. You have 5 years to register your qualification with us at the NMC. You don't have to do it immediately, but after 6 months, we do ask for some additional information if you haven't done it within that 6 months. And that additional information, all that we ask for is that there's a declaration that you make, and that declaration is supported by somebody else who is a registered nurse or midwife. And they must have known you for at least a year and been in contact with you in the last 6 months, and they must be able to confirm your declaration of health and good character. That's the only things we ask for as extra if you don't apply to join within the 6 months of qualification. If you don't register until after the 5 years, you'll need to undertake a test of competence or a programme that leads to registration. What I will say on that, should that be the case, please do contact us before you embark on either of those, so we can give you all the information you need to allow you to then apply to come onto the NMC register. Next slide, please, Paul. And then finally, there's some guidance there around the requirements for the test of competence. I'm not going to go through all of those. This presentation is shared with you, but it just gives you just a little bit of information around that test of competence, and if you want to join the NMC register after that 5-year period has happened. Next slide, please, Paul. And that's the end from me. I shall now hand you back to Paul, and thanks for giving me the opportunity to come and speak to you today. I wish you all the luck in your career, whether you start that now or at some point in the future. So yeah, good luck from me.
So I'll just jump ahead and introduce Vesta, who's the registration manager from the HCPC. Over to you, Vesta.
Thank you, Paul. Hello, everyone. I'm Vesna Maglov. I'm registration manager in HCPC, registration department. Today, I'll be talking a bit about our regulatory function, HCPC registration, and continuing professional development, CPD. We'll go through what CPD means, what to expect if audited, how to record CPD, and what activities we consider as CPD. I hope this will be also useful for those of you that are not on our register, but with the hope of demystifying the process. Next slide, please. So a Health and Care Professions Council is the independent UK-wide statutory regulator for a range of health and care professions. Our legal powers come from the Health Professions Order 2001 with the core purpose of safeguarding the public. If yours is a regulated profession, that means that your title is protected by law, and you need to be registered with your regulatory body to practice under the protected title. Sorry. If you are one of the 15 professions we regulate, you would need to be registered with HCPC. And we, Paul, I think this is, perhaps we skipped one slide before this. Yes, sorry. So as I said, we derive our powers from Professions Order 2001 with the purpose of safeguarding the public. We are accountable to PSA, Professional Standards Authority, for the standards of good regulation. Just to say a couple of words about my department, in registration we called Register of Registered Professionals, and we review applications for registration, whether that be UK or international applications. We handle appeals, renewals, continuing professional development, which I will refer to as CPD, and we provide frontline support to our registrants, applicants, and members of public in general. Next slide, please. So we set standards of education and training, and if you join the register through a so-called UK route, it means that you have completed one of our HCPC approved educational program. Graduates from those programs are automatically eligible to come on our register. If you came on our register as an international applicant, your application is assessed individually against the same standards of proficiency, so we ensure equivalence in standards of proficiency and fitness to practice between UK and international applicants. We also have standards of conduct, performance, and ethics, which set out what the public can expect from our professionals in terms of their character and fitness to practice. And today we will focus especially on CPD, Continuing Professional Development Standard, which is an ongoing standard to maintain your registration. Next slide, please. So as a multi-profession regulator, we oversee 15 professions, each with its own fixed two-year registration cycle. During the renewal window, which opens 3 months before the cycle ends, registrants are invited and also reminded to renew their registration. In parallel, we also run the CPD audit. During the renewal window, a percentage of registrants, that is 2.5%, will be randomly selected to submit their CPD profile for the current registration cycle. Next slide, please. Most of our registrants work in a range of different settings, whether that is a clinical, non-clinical, managerial, research, teaching, etc. The CPD is about keeping those skills and knowledge up to date within your current or future scope of practice. This responsibility is entirely on the registrant to make sure that they are keeping their skills and knowledge up to date, to ensure their continued fitness to practice, but also to ensure they're drawing upon their skills and knowledge and developing within their role. We have designed our approach to be flexible, to recognize the wide range of health and care professionals that we register, the diversity of their roles, but also the varying level of access that our registrants may have to different types of CPD. So CPD is fundamentally about maintaining and enhancing your knowledge and skills to ensure you remain fit to practice throughout your career. It is entirely specific to you and your individual scope of practice, and there is no single prescribed approach. Our CPD model is self-directed, outcome-based, and focusing on the impact of your learning rather than accumulation of hours and points, and there is no requirement for an official sign-off. Next slide, please. So therefore, CPD standards against which each profile is assessed if audited. These are the 4 standards, hopefully very straightforward. You must keep up-to-date record of your CPD activities, ensure your learning includes a mixture of activities, and ensure your CPD contributes to the quality of your practice and service delivery, and ensure your CPD benefits your service users. Next slide, please. So the first standard of CPD is to keep continuous, up-to-date and accurate record of your CPD activities. And the key advice I would give here is that if you are selected for audit, we will need to see your CPD activities covering the full two-year registration cycle. Now, looking back over such a long period can be challenging, which is why recording CPD on an ongoing basis and regularly is essential to meet this criteria. There is no right or wrong way to record your CPD. Some may prefer using a CPD app that we know some professional bodies endorse. Others may use simple Excel spreadsheets, Word documents, any format that enables you to record basic information such as a date or a range of date and the type of activity you undertook is completely acceptable for us. We don't endorse specific CPD activities. Instead, we expect you to identify your own development needs and choose activities that support your professional development. What matters is the impact of your learning, how it has strengthened your practice and benefited your service user. So this slide is just to show how a dated list might look like, and some activities like journal writing, e-learning, reading articles, and so forth. So the level of details you're capturing here is just the date and the range of dates with the name of the activity. So next slide, please. On this slide, I just wanted to present various types of activities. In practice, most registrants will carry out various types of learning while registered with us, and there are numerous types of CPD activities, and we defined it as any activity that helps you reflect, learn, and develop your skills. So you can meet our second requirement, that is a mixture of CPD activities through work-based learning, being involved with professional bodies, formal education, which most people recognize as the most obvious form of learning, but for us is just one type of CPD activity. Then self-directed learning, very suitable for people who are currently waiting for employment and are not registered yet, or any voluntary work. So the key is that your activities are relevant for your current or future practice. And next slide, please. So evidence that you provide with your profile may include materials produced by others, materials produced by yourself that you have created, any reflective evidence such as notes or development plans. So the evidence that you are providing with your CPD profiles should support your CPD examples. And next slide, please. And Standard 5 is not a new standard, it's a requirement to submit a CPD profile upon request. So at each renewal cycle, 2.5% of a profession will be randomly selected to submit their CPD profile. So they will be CPD audited, as we call it. Selected registrants must submit their profile before the end of the renewal period. Of course, there are exceptional circumstances where we approve extensions, and I will later on also speak about the possibility to defer the actual audit for the next registration cycle. And profiles are reviewed by our trained CPD assessors, our partner assessors, who are usually, if not one, a minimum from your own profession. Next slide, please. So this is just the content of the CPD profile once you submit it. So it includes a dated list of CPD activities, which covers standard 1 that I previously mentioned, a 500-word summary of your recent work. In the CPD list, our assessors will also be able to assess standard 2, which is the mixture of learning activities. They'll be able to see if you've had more than 2 types of activities. 500 approximate, of course, word summary of your recent work is there only to set your CPD profile in the context for assessors to see if your CPD activities are relevant. And also there is a word statement of how you met CPD standards. 4 or 6 CPD examples, not more. We don't recommend more than that, just the strongest example that you think best represent your CPD development in the last 2 years, and supporting evidence. When we say evidence, is just to support those previously mentioned examples that you provided in your statement. Next slide, please. So, as I mentioned, the option of deferral, if circumstances such as maternity leave, long-term sickness, caring responsibility, or other matters prevent you from completing your CPD profile, you can request a deferral. So deferral postpones your audit requirement to the next registration cycle. So on the next registration cycle, you will be automatically selected. You will not make a pool of those that are going to be randomly selected. That is basically it about the deferral. We always have on each audit a certain percentage of registrants that for whatever reason cannot submit the profile. I have to mention here that if you have recently joined our register and you haven't spent more than 2 years or full 2 years on our register, you would not be eligible to be selected for audit. So you'd be able to renew your registration for the following 2 years. Next slide, please. So I wanted to here say a little bit about how you can maintain your CPD while waiting for the employment. It is important to remember that your CPD doesn't need to wait until you secure your first role. You can, and I hope this information also goes for those that are not amongst those 15 professions that HCPC regulates, but also for those of you on this call that perhaps are from NMC or are other regulators. You can begin building your CPD straight away through self-directed learning. This might include reading professional articles and guidelines, watching webinars, online lectures, keeping up with new research in your field. We fully recognize self-directed learning as a valid type of CPD. You can also engage in a variety of learning activities, not just formal courses. While you're searching for employment, you can still take part in free online conferences, professional body events, reflective discussions, peer networks, and so on. One moment, please. A reflection is another essential part of CPD. Newly qualified professionals should take time to think about what they've learned, how it might shape their future practice, and how it will ultimately benefit service users. And so it's equally important to start keeping an up-to-date CPD record right from the beginning. So even before the employment begins, maintaining a simple digital or paper log will make things much easier for you later on. And finally, if possible, if you may wish to get involved in professional or voluntary activities, this could include volunteering in relevant environments, shadowing experienced practitioners, or joining professional groups or committees. The HCPC does not approve or prescribe specific CPD activities. We instead value any type of learning or development that contributes to your professional growth. Next slide, please. So this is our second year doing CPD week, and this year it will take place from 3rd to 6th of March. We do this to highlight the importance of CPD across all the professions we regulate. Throughout this week, you can take part in 5 online learning sessions that are on this slide, each focusing on a key area of our standards and professional practice. These sessions are a great opportunity to deepen your understanding of CPD and explore what good CPD looks like in practice. Anyone interested in getting involved can register to join the sessions, and we encourage you to share your experiences on social media using the hashtag CPD Week 2026. As this event approaches, the HCPC website will continue to provide updates and additional resources. For full details, please visit our HCPC website and follow us on social media channels. I hope some of you will get registered for this this week. Next slide, please. I've selected here some useful email addresses to get in touch with us, with our comms team at communications@hcpc-uk.org. Then for general queries, we have registration inbox, and for CPD specific queries, we have CPD profiles. Thank you, everyone. If you have any questions, I'll be on the call for the rest of the presentation.
Brilliant. Thank you so much, Vesna and Mark, for his information on NMC registration as well. So thanks so much for a great overview of the importance of professional registration, dispelling some of the myths, advice and support for those particularly on these calls or watching the recording who are going to be looking at doing this for the first time. I think it is, we hear this quite often, it's quite a scary process. So having all that information and advice, and as Vesna and Mark have said, we've got the contact details there. You've got the registration teams to contact as well for some further advice and support as well. Please remember the professional professional bodies, registration bodies are there to support you. They're not there just to kind of, be the kind of headmaster, so to speak, when things go wrong. They are there to support and help. So please reach out and please utilise the resources that are
Paul,
out there as well.
If I may add here, because it's very important, the point you just made, to demystify the CPD audit, because we know the uneasiness of our registrants when they hear that they've been selected, and we want to demystify that myth of us being a regulator who just wants to scrutinize and remove someone from the register. Removal from the register due to CPD reasons is a very extreme move for us. We would only do that in a very extreme circumstances where registrants don't engage with us after multiple attempts, after multiple rounds of further information, do not manage to meet our standards. So on our website, there's also statistics about the outcomes of audits in previous years. We publish that regularly, I would say. So if interested, you can check different professions or your profession and see how small the percentage of people that we actually remove from the register, because we try to be supportive and support people throughout the whole process.
Brilliant. Thanks a lot, Vesna. And exactly the same goes for the NMC. You'll see on Mark's presentation, he does exactly the same and highlights, the minuscule figures of it is that those that are end up moving away from the register, or, taking off fitness to practice or struck off, those kind of things. It is very, very small. Your professional regulators are there to support you. So hopefully that message has come across loud and clear. And it's fantastic on this additional webinar. Vesna shared that information there for the CPD week as well, so please join in those and access any of that information. You will get the links on the slides that you can click on to register as well. Are those other webinars as well, or those presentations, sorry, Vesna, or they're a mixture?
It is a mixture.
Yeah, brilliant, good stuff. So yeah, all the links will be available to everyone on there as well. Thank you very much. So cracking on then, as I mentioned earlier in the introduction, I'm just going to quickly go through a bit of an introduction to the National Career Service, just very quickly, what it is, what they do, what they support with, and also the webinars that they've got coming up that I think will be really, really beneficial to yourselves and to any other colleagues, any other students, or any other newly qualified professionals that you are working with or that you're studying with at the moment as well. So please feel free to share all of this information as well. So in terms of the National Career Service, I think a lot of people think career service, it's for young people at school, at college. National Career Service runs an adult career service contract. So it's free to access. It's impartial information, advice and guidance for as broad or as specific as you like, and it's available across the whole country. So on this particular slide here, just a very quick overview there of the sort of broader areas, the general advice and guidance about any career, careers in the job market. So you will have local National Career Service advisors who work out in the community, who can advise you what's out in your local towns, cities, region, and where the growth areas are, where there's going to be new opportunities, things that we call labour market information, where are the jobs coming, where are the jobs retracting, all of that information and data they can provide. Additional training and courses that are out there, any funding, learning options, and also understanding your skills, understanding your strengths, areas for improvement, self-directed learning, those kind of things that are really got highlighting your personality. Those things are really key when we're coming towards talking about application forms, in interview skills, being able to talk about yourself confidently, being able to talk about your strengths and skills. NCS, National Career Service, can really help and support highlighting those, or help you identify those skills as well. So the information is available from, I'll just click through these slides, both face-to-face, whether that be you know, out in the local community, so places like local job centres, community hubs, libraries they work out of. You don't have to be signed up to any of those places to do a face-to-face appointment, but it's just where they're hosted and where they're out in the local community. They do online telephone appointments and webinars similar to this one as well, which once again I've mentioned, and I will highlight the ones that they've got coming up that I think will be really useful for you guys as well. Just an additional bit of their support there, things like help with CVs, reading over them, preparing for specific interviews, assessing your skills and experience against job opportunities, and helping you do application forms. Those are all kind of things that they can support with as well. The digital service offer as well, they do have a website. Once again, details you'll get at the end of this session there as well. And you know, they've got the job profiles on there, loads of information, over 800 job profiles about what's required, skills, qualifications, expected salaries, where the jobs can lead to. So once again, that might be something that gives some of you opportunities to see where your career path may expand to, and related jobs if you wanted to kind of do any additional training, or you wanted to work at a higher level, or you wanted to do a sideways move into another role. It'll give you an idea of what expectations you would need, any additional training you would need to do, or where it can progression opportunities can lead to in your particular areas as well. So that's easy to access on their website as well. The skills assessment that I mentioned earlier there about motivations, strengths, matching those to potential job roles or job sectors, but they're really useful for skills assessments that you might have to do at some point for a job application. For it might be group interviews that you may need to do. You may have to do an online skills assessment. That's just really useful practice, and just gives you the confidence to know what you're good at, what you need to work on, and what you can talk about confidently when you're talking about yourself, and how you match up to specific jobs as well. Course finders and general advice and supporting on things like job hunting. So there'll be other advice and information they can provide on different job websites, things like using LinkedIn to develop new networks and opportunities to speak to potential employers, you know, other opportunities to utilize social media to apply for or find job opportunities, the likes of Indeed and other job websites. National Career Service are well placed to have a chat about that. So you know, don't exclude any of those other additional opportunities we might not be talking about today, or places to look for jobs. Your local career service will be able to highlight those as well. And then very finally on that particular point, the workshops that I mentioned, the online workshops that are focused on NHS applications and interview skills. Now, these are completely free to access. I will just point out what you'll see on the email address there, where it says to register. You can call or you can email bookingline@edt.org. Now, I've been mentioning National Career Service, and some of you might be thinking, what is EDT? That just stands for Education Development Trust. And they are the regional organisation, the Regional Education Trust that hosts the National Career Service contract. So don't think that that's a typo or it's something untowards. It just stands for the organisation that runs the career service contract in our region. So to sign up on those workshops, either give them a call on that number, email the booking line, let them know that you want to attend the NHS applications workshop. They had some dates earlier in the year, but you can see there they've got them coming up on the 10th and the 27th of March. It's going to be held on Teams, the same as this webinar. So if you've been able to access this, great, it'll be the same format. It will be a big group session. There'll be opportunities for you to chat or ask questions about specific scenarios, and you'll need to register. And by doing that, you need to register with the National Career Service. So once again, it's free. It's confidential to do that. By registering with them, you're just saying you're accessing support from the National Career Service. They're not passing on your details to anyone. They're not going to be trying to sell you anything. It's just so that they know that you're a client of theirs. And if you do need to book in any further one-to-one sessions afterwards, you can do. You're registered with them so they can see that you've attended the virtual workshop for NHS applications and interviews, and then they can pick up the discussion with you from there as well. So that's an important point to note about the registration there. That'll come out on the slides. I definitely would recommend accessing it for the group and the one-to-one support. And please share that information with anybody who's out there in the same situation as you guys, looking for your first job in the NHS or elsewhere in healthcare professions. Please share that out there, because they'll be able to tailor advice and information to support all of you there as well. Okie doke. So moving on then, I'm just going to introduce Chloe, who's from Spectrum Community Healthcare. I'll load up your first slide there. Over to you, Chloe.
Thanks. Hi everyone, my name is Chloe Haig. I'm Deputy Director of Nursing and Quality at Spectrum Community Healthcare. So I'm just going to take this opportunity to tell you a little bit today about Spectrum, and I guess possibly give you some other ideas about things that you might explore whilst you're looking for your first roles and positions. Spectrum is a fantastic company to work for. We are a community health company, so we do have Agenda for Change contracts, which I know is quite important to some people, and we do work with a lot of newly qualified healthcare professionals from different backgrounds. Can I have the next slide, Paul? Okay, right. So Spectrum Community Health we cover the north east and the north west of England. We work really closely with our commissioners, so we provide an NHS service, and we are a community interest company, so it's a not-for-profit organisation. So any profit that we do make gets ploughed back into the services that we run. So we have different initiatives and projects that support not just the people who use our services, but the people who are in the communities where our services are based. And what we can do with that is it enables us to work flexibly and to do lots of patient-centred and person-focused care to respond to the needs of the people who we deliver care to. That'll probably all come a bit clearer in a minute when I tell you about some of the different services that we have. But it also means that it enables us to remain focused on our patients, on our people, and a lot of the work that we do, well, the majority of the work that we do, we're really proud of, because we co-produce it with the people who are receiving the services. And this is so important because it makes sure that things make sense to people who are on the receiving end of our care. So the majority of our services are clinically led, and we give staff a real say across Spectrum in the future direction and what's happening. As you move into the world of healthcare, in whichever different area you guys end up working in, things often change at quite a fast pace. And because we're a community company, and when you look at the NHS 10-year plan, they're looking at moving lots of things into the community to try and promote community care. Spectrum is looking at sort of different ways of I guess growing really and providing different services. So community services are definitely sort of on the increase. The culture in Spectrum, so we ensure that we encourage staff involvement at all levels. Like for me, I am out and about at our sites quite often, but when I'm in the office, my door's always open. Microsoft Teams, we're always getting pings all the time for sort of questions and support. But what we do is we just make sure that we support our workforce and that our workforce feel valued and valuable. We are, as you will see when I talk and go on to the next slide and tell you about our different services, is we've got a values-driven ethos. A lot of the people who we provide our support and care to are really vulnerable people. We have different people from allied health professionals working across the Spectrum organisation, and we hold social values really close to our heart in everything that we do. Next one, please, Paul. So this is our site and our services. I'll tell you a little bit about me and my nursing career so far. So when I qualified in 2008, I was in a similar position to you guys. The posts were few and far between, but I was lucky enough to get a job in my hometown of York, well, home city even of York, to work in the cardiology department. And after that, I went into safeguarding, then I went into community work, and then I worked at NHS England for quite a few years, and have now come back to working in a provider. So what you'll see on that map there is probably some services as healthcare professionals that you may not have even thought about. And I don't actually think until you work in health and justice that you realise quite how many health and justice sites there are. So across the northeast and northwest, we are the second biggest provider, and the first biggest provider is a company called Patient Plus Group. You'll find them if you do internet searches, and I know that quite often they have positions as well. So it really is worthwhile kind of looking at some different services that wouldn't normally come across your radar. And a bit like us, we take on newly qualified nurses often. We also have healthcare support workers who then become nursing associates, who then do the nurse training. When you come into Spectrum, we've got sort of lots of different opportunities once you've kind of built your knowledge and understanding and you're feeling a bit more confident and you've had that preceptorship. So you can see from this lovely map here that all the purple ones, there are health and justice sites. So ultimately they're prisons. There are lots of prisons, don't think you realise quite how many. And what we do as an organisation is we provide primary care in prisons. That's sort of our label. But actually we do so much more than that, because we're working with people really who have a lot of the time not had the greatest start in life, which unfortunately means they're not the healthiest of people. And when they come into the health and justice setting, what we're looking at is the best way to be able to support them. Often they'll have had difficulties and barriers accessing healthcare. So if working with people sort of from deprived populations or people who have additional needs, we have lots of people who are neurodivergent in prisons, which probably wouldn't surprise you. And actually we not only look after them sort of in a primary care sense, but we work really closely with teams like public health teams, and it's a really interesting place to work. I've just been here for over 18 months now, and I still learn something new every day. So we've got different categories of prisons. That's the way that things work. So if you look right at the top of the slide, we've got HMP Franklin, that's up past Durham. And HMP Franklin is a Category A men's prison, and then you will see next to it that we've got Low Newton. That's a women's prison. Women's prisons are slightly different. They don't have categories. And we go all the way across to Liverpool, and we're quite widespread. We've got a GP practice, and then the green ones you'll see are substance misuse hubs. And I'll tell you a bit more about the hubs and the community services. And then orange, although I've missed the one off the bottom, I do apologise, that should be Barnsley Sexual Health Services. We've also got 2 sexual health services. Next slide, Paul. So, like I said, we're the second largest healthcare provider in the UK, and we have primary care services across prisons. I think we kind of undersell ourselves a little bit when we talk about primary care services, because actually we look after people holistically when they're in prison. So from the moment that they come through the door, so in an acute hospital trust, you'd call it an admission. In a prison we call it a reception. So we're looking after people as soon as they've come in from court until the moment that they leave, with the aims of handing them over to healthcare providers in the community. So we've got immigration centres, we've got short-term holding facilities at an airport, and then we've got some liaison and diversion services as well. So like I said, reception to release, code red, code blue. So these are the kind of the emergency call outs that happen when you're on a prison site, health promotion, long-term condition management, wound care, inpatients, and care and separation units, which are a bit like inpatient units. So we as a provider work really closely with the mental health teams. PPG is slightly different because they employ the mental health nurses directly to work with them. So again, if that's something that you're looking for and that's the area that you've qualified in, it's definitely worthwhile having a look at. Next one, Paul. Yeah, so this is a little bit about our sexual health services, which again, we have newly qualified nurses working in sexual health services, and across different areas, they're run by different people. So it's really worthwhile kind of casting your net out and having a look at what's going on. So these are nurse-led services, and you do get supported to become a specialist nurse, non-medical prescriber. And we also go out and have teams who work across the community delivering relationship and sex education in schools and across schools in the Barnsley and Wakefield area. Next one, Paul. So a little bit about the community and substance misuse stuff. So liaison and diversion is a service which the aim of the teams there is to provide early identification and support for vulnerable people. And so it's just as they come into the attention of the low-level criminal justice system. So it's supporting them, supporting concerns that might be raised by the police or probation or youth offending or court staff, to work with them to hopefully keep them out of one of our prison sites by signposting, supporting them to access the right services and making sure that they've got the right links into different partners. So it's a fantastic opportunity, again, to work with lots of different teams, and you're really supporting people with vulnerabilities. Oh, I struggle to get that word out. Vulnerabilities such as things like homelessness, substance misuse, domestic abuse, debt, emotional and mental health problems, and they're based in hubs. So we provide this service and we work with a group of different people such as Humankind and Change, Grow, Live and Changing Lives, to really sort of support the vulnerable people to stay well within the community. So we've got them across North Yorkshire and then also up in kind of the Teesside, Tyneside area, and they support but again, take on newly qualified nurses and allied health professionals. It's nurse-led, and again, you have the ability to be able to access extra training and support so you can get to the point where you're non-medical prescribing. And we've got community sites that are sort of dotted around across North Yorkshire and the North East. Next one. So primary care, we've got the primary care services. Primary care, although I'm talking about health and justice today, I think a lot of people, there's a bit of a myth that you can't work in primary care as a newly qualified nurse, and you absolutely can as an allied health professional. So it's something that's really worthwhile looking at dropping in, seeing what's happening in your local primary care networks, which is when a group of GP practices have come together to really sort of look at that community-based care. So really sort of have a look out and see what's happening in your communities locally as well. Next one. Okay, so this is kind of a rough idea of the sort of things that can happen with us. So we have now developed, much as an acute hospital trust would, a really good preceptorship programme. We've got a learning and development team that sits within Spectrum. We ensure that when staff come in, they have that supernumerary time. Now, I would say if my friend and colleague Susie Ingram were here, she'd be telling you she has prison nursing running through her blood. She absolutely loves it. It is a really, really interesting environment to work in. But actually, I think, for anyone, because it's so different to the world that we live in, it's always worthwhile reaching out. Heads of healthcare are the people who run the health and justice sites, and it getting hold of people's contact numbers if you want to do that is always, you've got, like I said, ourselves at Spectrum, and then you've got Patient Plus Group as well, and you can find that information online if it is something that you think that you'd like to have a look at. At Spectrum, we always make sure that people have got allocated preceptors. We've got a network. We're able to, as I said, pipeline. So as a newly qualified healthcare professional, we've got so many things happening so people can do the non-medical prescribing. And then we also work really closely with Teesside University. There's now a specialist qualification in health and justice, which is fantastic. So we're just about to move into the second year of that, and once we have had nurses who have worked with us or allied health professionals for 18 months, they can then apply and express their interest to go on that course, and we support people to do that, which includes your non-medical prescribing as well. So that's fantastic. So we've got 14 prisons, 2 sexual health services, 3 drug and alcohol community services, and an in-bed learning and development team. So I think all I would suggest is to really kind of have a look and have a think about what's going on locally in your area and some different areas of community nursing that maybe you wouldn't have necessarily considered before. Looking at things like primary care as well is a fantastic thing to do. And I myself spent 4 years working in primary care and loved every minute of it, and have taken those transferable skills to do different things such as this role. So I think that's me, but yeah, good luck everyone.
Thank you so much, Chloe. That's brilliant. I think it's great to get, we've had Chloe come and do a chat a couple of times just to give a fantastic overview of those very different areas. I think a lot of people training either don't know about or are totally unaware that there's nursing or AHP jobs out in health and justice, sexual health, community substance misuse, and it might be roles that they've never even thought of or never tried. And as you mentioned, Susie, who also joins in many of our conversations and calls, does it and absolutely loves it. And that's what we tend to find when we speak to a lot of those nurses or other healthcare professionals who work in those areas. Wouldn't have chose it initially, but they've gone into it and they've absolutely loved it.
Yeah,
but it might be a great starting point.
Yeah,
for a lot of
we've got
careers.
we've got paramedics, we've got ODPs, we've got different people who've branched into working in health and justice. And, you know, it is a real eye opener, and a bit like working in acute hospital trust, there's different things that meet different people's sort of like skills and interests. But actually, I mean, I find it fascinating. And like I said, I learn something new every day, and you meet some really interesting people.
Yeah, absolutely. I've previously done some work in prisons as well. You're right, it's fascinating, and I think it teaches you a lot about communication skills and working with people and judging people as well. I think it's a good, great key skills to be gained from there as well. Thank you so much. And I think I wanted to touch upon a couple of other points you mentioned as well, Chloe. Really glad that you mentioned about primary care and the role that you do in that. And it's just as a heads up for everyone that we did a webinar on primary care, and we got one of the primary care hub leads to talk in a lot more in depth about that. So we've got that information to share. And also with you mentioned about Practice Plus Group. I'm going to send out a handout for other employment support links, and we've got all of the contact details, all the website addresses for the primary care hubs across the region and Practice Plus Group, Spectrum, CIC, as well as their vacancies page for their website it links to, and we've got quite a lot of other organisations that are around the area that do similar or private or CIC roles or independent providers. We've got loads on there as well. It's not exhaustive, and as Chloe said, I think have a bit of search around, pop into your local GP surgery, have a chat, look what's up on the notice boards in places like that, because there'll be other organisations advertising stuff out there as well. So I think there's that additional support we'll send out after this session as well. I'm having a look, I'm just checking the Q&A and the chat. It is a really small group over this lunchtime session, so we've got a lot of people registered that this is going to go out to, and if any of those want to come back to us with any questions, they're more than welcome to do so. I'll share our general email address again in a moment, but it was also just to flag up to everyone watching this recording that we do have something called our regional transitional support program, and essentially this is a newsletter that our nursing and midwifery and HP workforce leads are sending out on a weekly basis. So if we get a heads up of any job opportunities that people want to promote, we share it out on there. If there's any other webinars, events, training opportunities, funding, anything else going on, we send it out on there. So if you're not signed up to it, it's free to do. We're not passing on details to anyone else. You literally just need to fill in a form to say, yeah, I'm interested in being part of the program, getting updates from across the region because I'm still looking for a job opportunity and I want some help. Then definitely sign up for it. It's going to be, like I say, weekly updates for you, and hopefully some great opportunities for you to be able to apply for over the coming months as well. And as I mentioned there, we have got our general email address, so anyone watching the recording has got any burning questions or queries or anything specific to their profession or studies, please drop us an email. We'll pick that up. We'll normally get an answer to you, within sort of 3 or 4 days. So please send something across if you've got anything that you want to discuss with us in further detail on there as well. So thank you very much for your time this afternoon, everyone who was able to attend and watch the recording. We wish you good luck and all the best. We're here for support. And as we say, good luck for your future healthcare profession roles in the North Eastern Yorkshire. Thanks very much.